What's going on, everybody? Welcome to another episode here on I've Got 10 on Dental Cast Productions. Very, very excited to be with you here on this Thursday. And we're going to continue our podcast series with the Dental Consultant Connection team. Robin Morrison has put together an amazing team of consultants. All of them are experts in their own right. And so we're going to continue this series for the next however long of 2019. So very, very excited to do that. Before we get started, I wanted to go ahead and give a shout out to my sponsor, TSYS, one of the nation's leading providers of credit payment processing, things like that, what have you. And they've put together an awesome activation credit promo for all of my listeners here on I've Got 10. So what I'm going to do real quickly is I'm just going to put up the name of the gentleman who you can call at TSYS. His name is Matthew Herndon, and he is there. He can help you. They're really good about walking through your current payment processing system and see if they can help you and all that good stuff. So go ahead and give Matthew a call. His number is on the screen. TSYS, great company. I spent some time down there in Charlotte. They're helping dental practices all over the country. All right. Leslie Canham, thank you so much for joining us today. How are you doing?
I'm doing great. Thanks, John.
So you are known to many in the industry as not only a compliance person, but I know there's not too many people in the industry that have that CSP by their name. And I wanted to make sure that I had that up there because it's an amazing accomplishment, which stands for Certified Speaking Professional. And so I know you speak nationally and internationally all over on what you do. So true honor to have you on the podcast today.
Thank you for inviting me.
All right, so what we're going to do, we're going to hop right into things today, and you're going to share some tips on compliance. We're going to focus a little bit on OSHA today, and I know you want to talk about, we talked about like 7 tips, both for the startup and the seasoned dental practices when it comes to OSHA. Again, I know OSHA is one of those things that maybe people don't always pay attention to, but I know you're going to make sure that you highlight some things that they should pay attention. So I'd love to have you go ahead and share that. The floor is yours.
Well, thank you, John. Most people think that they have completed all of the requirements for OSHA, but they're not really certain. And I like to give some tips. I have 7 tips to just take the pulse of your practice to see if your practice measures up to what would be considered OSHA compliant. So the first tip I ask people to look at is whether the clinical team is wearing the OSHA required personal protective equipment. So you can easily take a look around and see, are long sleeve gowns or clinical jackets being worn? Is protective eyewear being worn? Not just prescription glasses, but actually protective eyewear.
Leslie, would you be able to do me a quick favor? I'm so sorry to do this, but this is really important. Would you be able to scoot over just a little bit? Because I want to get these tips on the screen. That's perfect. Okay. Yeah, it's super. I want to make sure this is good stuff. So that is perfect. Thank you so much. I'm sorry to do that. Sure. I just want to make sure those are up there or whatever. So okay, sorry about that. Floor is yours.
And the third area of personal protective equipment is with regards to the face mask. A lot of times when I audit dental offices, I'll see the mask below the nose, and that's not protecting anyone. So it tells me when I see that the appropriate personal protective attire is not being worn or not being worn properly, that the team hasn't had recent OSHA training. The next step, number 2, is I watch and see how the clinical team transports their contaminated instruments. Now, back in the old days, we pretty much didn't have OSHA to tell us what was safe and what wasn't. But when I see team members transporting contaminated sharp instruments by hand, I know that they haven't had any recent OSHA training or any training at all. Speaking of hands, are hands being washed before and after glove changes? Now, I think I would guess that the average person that is not in the healthcare industry would think that if you put on a pair of gloves, your hands are protected. But with what we touch and how we wear our gloves, sometimes the gloves can have little micro perforations or pinholes. And when we remove the gloves, sometimes what's on the outside of the glove can land back on our skin. And then probably the best reason to wash hands after you take your gloves off is because bacteria and flora can recolonize on your skin pretty easily underneath that warm, moist glove environment. So when I observe dental teams and proper hand hygiene, washing before gloving and after gloves are removed is not performed, I know that they haven't had not only any recent OSHA training, but probably not any infection prevention training. That's really the first step in infection control. The fourth step, really to kind of take your pulse, is to ask yourself if you've conducted OSHA training in the last 12 months. OSHA requires bloodborne pathogen training be conducted every 12 months. And I know 12 months seems to fly by in dentistry. So sometimes we think we've done it recently, but when we look back, it's been quite a while. In fact, I always laugh when, for example, my memory in dentistry is people would say, oh, you don't need to take my x-rays. I just had them. I just had a full series of x-rays. And we would say, well, it's a standard of care to take those x-rays every 5 years. Oh, I just had those x-rays last year. We look back on their records and it's been 7 years since they had those x-rays. So time can fly. And just like patients, the same thing for us. We can think we've done our training, but we haven't done it in several years. And that's a pretty severe OSHA violation. The next tip, number 5, is when I'm lecturing, I ask my audiences, do you have a healthcare provider or a hospital or a facility arranged in advance where you will go if you have an accident, injury, or a needle stick? Most of the time, people in my audiences, well, they typically don't. Maybe I'll get 10% of the room will raise their hand. So ask yourself, ask your team if they know exactly what to do in the event of an exposure incident, particularly what healthcare provider they're going to go to, because time is of the essence when you have an exposure to blood or body fluid. Now, that leads me to tip number 6. Do you have an up-to-date OSHA manual? All of the safety plans in the OSHA manual should be designated for dental practices and should be personalized for a particular practice. So it should state where you go for your emergencies, who you report to, what paperwork you take, and then, of course, the written plans on how to prevent accidents and what to do if you should have an accident, step by step by step. So having the OSHA manual up to date will probably give you all the information you need on the 5 tips I've given you already. And my final tip would be to ask yourself, would you pass an OSHA audit? If an OSHA inspector came to your practice today, what would happen? What would that person see? Would you be in trouble? Would you have a laundry list of things to correct? Or would you be issued a citation or fine? So there you have it, the 7 tips to see if your practice is OSHA compliant or not OSHA compliant.
So that last one, I have to ask you, how many practices that you work with, when you ask that question, actually do say, you know what, Leslie, we are a little scared. That's why I wanted to reach out to you and have you. But do you find that a lot in the work that you do?
Well, I tell you, that's the phone calls I get are typically that type of phone call. And it's usually because someone left the practice who wasn't happy with the doctor and made some threats to contact OSHA. And sometimes they do. And so a dentist doesn't really know if OSHA is really going to show up or not because they don't make an appointment. There's no date with OSHA. They show up and it's a surprise visit. Right. So, yes, I get a lot of phone calls like that.
So you mean when OSHA was there last time, it's not like a recall appointment, right? Where they go ahead and get on the books and let you know when you're coming again.
No, that's right. That's right. They don't give you any forewarning of when they're going to show up. So if someone has stated that they're going to complain and it's an OSHA violation, like, sometimes people will say, the doctor made us wear the same gloves all day long. We had to wash our gloves. Huh? That's a pretty serious violation. And of course, it's probably not true. But, if there was something like maybe there wasn't an eye wash station in the practice, that's another serious violation. And dentists know I need to have an eye wash station, but I just haven't gotten around to either fixing the one I have or hooking one up. So that would prompt probably a pretty rapid OSHA audit, or at least an inquiry from OSHA.
Right. Excellent. Well, thank you so much. Great tips, as I think as practices are certainly looking to make sure that they're compliant, always a very, very important thing. And I have up on the screen the phone number for Dental Consultant Connection. If for any of you that need assistance in this area in your practice, I'm sure in some form or fashion everybody does, you can go ahead and contact Leslie. She's on the Dental Consultant Connection website. Went ahead and actually put that URL up on the screen just a little while ago. And of course, we've got the phone number up there. So if anyone wants to go ahead and reach out, learn more about Dental Consultant Connection, learn more about the great work that Leslie is doing. And this is great stuff. Leslie, I appreciate it so much. I know right when we get done here, we're going to go ahead and record a little audio podcast, which will be up on the Digital Trade Show Dental Audio podcast on iTunes. And what we'll do is we're going to learn a little bit more about Leslie. She's going to share her story, how she got to where she is, and then she's going to go over some of these same tips if you want to listen to this on your way to the practice or working out or whatever the case may be. So Leslie, as you can notice, my light just went out, that light bulb. It's been going for a long time, so it suddenly just got dark here in my little studio. But I want to thank you again for coming on I've Got 10. It's been a pleasure, and we'll talk soon.
Thank you very much for inviting me.
All right. Have a wonderful week.